that's where we obtain our stem cells. Okay? So there's no embryonic stem cells. We're not harming a fetus. We're not harming doing anything like that, although there are stem cells that come from embryos. I don't feel in my personal, that's not ethical to me. Okay? That's just my personal belief. So we don't get them from embryos. What we get them is from healthy mothers that choose to have a C-section and donate the amniotic tissue and the umbilical cord tissue to science. Okay? Now, so those are the three types of stem cells that are available in the U.S. All right? So let me give you a couple other reasons why with adult stem cells you want to kind of rethink that. Because there are clinics across the country, out of those 880, about half of them are offering adult stem cells and about half are offering donor cells. Okay? Here's some other reasons or other things to consider when you're looking at adult stem cell treatment. One is that when you, in the United States, the rules and the guidelines at which we go by tell us that when we do like a bone marrow aspiration or we do an adipose tissue harvest, that when we harvest those stem cells, that we actually have to apply them on the same day that we harvest them. Okay, so here's the problem with that. So when you go into the bone marrow, you actually have a spot about this big which you have to hit to get adult stem cells. Okay? So it can be done, but let me ask you something. If you were getting that treatment, wouldn't you want to know that there's stem cells there that came out? So to do that, I have to send them to a lab. I can't send them to a lab and then get them back and inject them to you the same day. So there's somewhat of a guess as to, did I get viable stem cells, and then how many of them did I get? Okay? Again, these are regulations that we have to adhere to inside the United States. I'll explain to you why that they don't outside of the United States. Okay? So, that is one major problem. And then the other part is the lab testing, even if we could do it, is so expensive that it outweighs the cost of the treatment. So, they can only be minimally manipulated, meaning they can be cryopreserved, they can be washed and cryopreserved. When I say wash, I don't mean like with soap and water. Washed meaning they have to be extracted from the tissue. The tissue has to be tested to make sure that there's no bacteria, viruses, disease processes, that they're clean and safe. Okay? They can't be grown or cultured. So our government has decided that we don't want to culture or grow stem cells. People are afraid, I guess, that Frankenstein will be created and so on and so forth. Or we'll clone ourselves, or which is being done. Yeah, I mean, from a standpoint of we've taken stem cells and taken like stem cells from a person's heart and actually cultured them and created a new heart that we could transplant back to that person. We're just not doing it in our country. Okay? So, I get it. There's some pros and cons to that. But if you're doing it in orthopedics, like if you were to go to Tijuana or you were to go to the Cayman Islands, you would get stem cell treatment. You would get adult stem cell treatment. They would do the aspiration. They'd actually send it to a lab, verify that you got the stem cell, that they got stem cells that are viable, and then they actually culture them in a lab so that we grow them so that we have a higher viability of the number of stem cells that we can re-inject. So they do that over about a 14-day period of time. And so if you do it like that, then adult stem cells comes more in comparison with donor cells, although you still don't get the number of cells that you get out of donor cells. So donor cells are a better option. Plus, you don't have to fly out of the country, flight cost, stay there 14 days, and then they're going to charge you $20,000 to $25,000 to do all that. Okay? So, donor cells are better. All right? So there are a couple things that we do in our practice that sets the standard, the gold standard for these types of procedures. So there are two very important things that happen with stem cell treatment. It's not just the mesenchymal stem cells, it's actually the cytokines and growth factors. So what is a cytokine and what is a growth factor? Okay, so these are the chemicals and catalysts that start the healing process in our body. So if you cut your arm, it's the neosporin that does the healing, right? The Band-Aid? No, our body does the healing, right? Okay, so to do the healing, so you cut your arm, it starts to bleed, you start to scab, then the scab falls off, new tissue is grown. So all of that happens with these things, these cytokines and growth factors. Okay, so these are actually enzymes that create and cause a reaction for your body to start doing remodel and repair. All right, so when we get our particular stem cell treatments, we actually get our cytokines and growth factors from the Wharton's jelly. Anybody ever heard of what Wharton's jelly is? So Wharton's jelly is actually it's actually a tissue inside the umbilical cord, and then the placenta and the amniotic fluid. It's very high and rich in cytokines and growth factors, millions and millions of cells. Not that high in actually naive mesenchymal stem cells. Okay, so when you go online and you do your Google searches and you start reading about amniotic stem cell injections, you're going to see some research that says, well, there's not that many viable cells in amniotic tissue or amniotic fluid, and that's why adult stem cells are better. That's true. However, there is a high viability of mesenchymal stem cells in the umbilical cord and the umbilical cord blood, which is really the most cutting edge way to do it. But you need both. You get phenomenal results with if I just did an injection with cytokines and growth factors, I still get phenomenal results. Now, if I just do an injection with mesenchymal stem cells, I get phenomenal results. But if I do both, now I've hit the jackpot. So that's what we do in our office. It's the gold standard. Very few offices do it that way because guess what? The cost to do for both is higher. But here's the thing. If you're going to get stem cell treatment and you want to resolve your problem, do you want to have the very best chance to do it? Or do you want a so-so chance? No, you want the very best. And so that's what we're into offering is the very best. Okay? Exactly. So we can provide both of those as a gold standard for treatment. And actually, if you compare, and I'll go over all this a little bit later, but if you compare our cost to do it are on par with everybody else, we're just spending more to give you a better result. Okay? Placental cells are safe. Okay, so the Stem Cell Institute of America, we've done over 50,000 orthopedic injections without one adverse reaction. Okay? The Hippocratic Oath is do no harm. That's where we start. So if nothing else happens, the worst case scenario, a patient doesn't get better. But we haven't heard. 50,000 injections without one adverse reaction. Okay? Most people ask me, well, do you have to have the same blood or tissue type? No, you do not. What's remarkable about these cells is that in the placenta and the umbilical cord, the only two tissues in the human body that don't exhibit the human leukocyte antigen, which is our body's ability to say this is foreign tissue, I need to and reject it through your immunoresponse. So if you have an organ transplant, even if you have an exact match, what you have to be on immune suppressant drugs so that your body will accept those, right? That's not present here because the human leukocyte antigen does not exist in those tissues. The only tissues in the body. Why do they not exist? Because if they did, the fetus would have an immune reaction to the mother. Good Lord made us in a remarkable way, and science has allowed us to find a way to create really new life, okay, without hurting anyone or harming anyone. Just great. So it's very safe. So I want to show you guys some testimonials and some pre and post x-rays that we've done, and then I'll open the floor to question and answer, and I'll try to answer any questions that you have, okay? So let's go through some of our testimonials from patients. So I'd been suffering with low back pain and left knee pain for 8 or 9 years. I had previously had my right knee and both hips replaced and was very unhappy with the results. I decided to have the injection on my knee and my low back because I was absolutely not having surgery ever again. Since my injection 1.5 weeks ago, my knee feels 80 to 90% better with very little pain. My low back is 50% better with little pain already. The injection did not hurt, and I've already recommended this procedure to 20 or 30 people. So the remarkable thing here is that this patient within 1.5 weeks of their injection is already feeling much better. But this is not a short-term relief type of treatment. The stem cells will actually proliferate for 8 months, millions of times over. So the best result is not 1 week later, not a month later, not 3 months later. The best result is somewhere 8, 9 months down the road. The fact that they're already feeling better is amazing. Okay? Let's look at their pre and post x-rays. Okay, so this was the knee before the injection. This was 9 weeks later. You think that patient feels different? Of course they do. So, that's pretty remarkable, isn't it? Can everybody see it? Okay. You see where we're bone on bone here? And now the amount of cartilage and space that we have in 9 weeks. This was done at 9 weeks. This patient is going to have another 6 months of stem cells continuing to work. Let's look at another one. Before I tried the amniotic tissue injection, I was having trouble just walking even 5 minutes. Does that sound familiar to anybody? Yeah, that's right. Walking upstairs had gotten so painful that I moved my bedroom downstairs to avoid having to go up and down them. I've even had patients tell me they sold their home. They had a 2-story home. They sold it because they could never not go up and down the stairs anymore. Every day I felt constant debilitating pain in both knees and eventually got to the point where I couldn't do my favorite activities anymore. My orthopedic surgeon told me they would have to do a full knee replacement and take almost a year to rehabilitate. Okay, so the rehabilitation time kind of depends on the patient's overall condition and age. I decided to try one more thing before going under the knife, and that's when I found the Stem Cell Institute of America. It's been almost 5 months since I had my first treatment, and I can honestly say that I'm pain-free for the first time in years. Seeing the changes on my x-rays has been incredible. Okay? Again, we did bilateral knees here. You can see the pre-x-rays and see how much space was there. And you can see after the injection, this is at 8 weeks. Pretty impressive. Put me in, coach. All right, I've suffered with chronic knee pain for the last 10 years. I've tried injections before, nerve blocks, and even Orthovis, that's your rooster shot. And each time they would work for a few months and the pain would come back. Sound familiar? Okay. I had heard about these injections from a good friend who had tried it and had success with it. I was a little concerned because the other treatments had not really given me long-term success. But not wanting to do surgery, I decided to get the injection. I've been pain-free for months now and no longer have to walk with a cane. It has definitely given me my life back. This therapy can change your life. So let's look at, we did a bilateral knee here. See bone on bone. At 9 weeks, you can already see the changes that have occurred in the cartilage, that the body is regenerating and creating new cartilage and tissue. Okay? All right. So, let me open the floor for questions, and then I'll close out and explain to you if you are interested in seeing if we can help you with your condition, how you go about doing it. Okay, I think everybody's about to get their food. Open the floor to questions. We'll just start this way and work our way around. Yes, ma'am.
Shannon, about 5 years ago, I came to you guys, and I couldn't lift my left leg. And I signed up for your series of treatments.
Yes, ma'am.
And at the second treatment, I could lift my leg and I could walk, and it lasted for about 2 years. And there was no injections or anything. It was just
therapy, right?
Of course, my insurance didn't pay for it.
Okay.
But I swore by you guys, and then my insurance will pay for like 3 treatments, and then you have to resubmit and all of that. Now, insurance won't pay for the stem cell.
That's correct. So
how expensive is it, and how can a person have it? I've had 3 cortisone shots. 1 worked, the other 2 didn't, and I can't really walk any distance without a walker.
And that, unfortunately, that is, that's what we typically see with patients that have problems with osteoarthritis in their knee, their hip, or their back. Is that they get to a point where they're on a walker or a cane. You brought up a very good point, and that's something that I'd planned to address before we were done here. The question that she was telling the story that she had been a previous patient of ours, and she had done quite well with the treatment for about 2 years.
Yeah.
And so that's great, and I thank you for sharing that. So if you want to talk to somebody about our professional